Hi everyone, in this video I'll talk about the imaging, diagnostic and oncology under ultrasound modality. Let's take a look at Mrs. Clanson case study. Mrs. Clanson, she's 58 years old, referred to breast clinic due to lump in her breast. She was diagnosed with invasive ductal carcinoma classified as T2N0M0 stage 2A. This means that the tumor is more than 2 cm but less than 5 cm. No lymph node and no metastasis is detected. The stages of cancer indicated the extent and aggressiveness of disease and helped guide the treatment plan. In this case, it was stage 2A. Let's take a look at oncology. Here comes a question. How did her cancer grow and spread at microscopic level? At microscopic level, breast cancer development cells in the breast begins to grow uncontrollably. These cells can form a tumor and can be seen on an X-ray or felt as a lump. The tumor is malignant if the cell can grow into surrounding tissue or spread to distant area of the body. In Mrs. Clanson's case, the cancer was spread in a local invasive way. That's why no lymph node and no metastasis is detected. In this way, cancer invade and grow into the surrounding tissue of the breast. Histopathological analysis is necessary to determine the malignancy of the tumor as it analyzes the image in the cellular level. In Mrs. Clanson's case, a thick needle biopsy was performed for her histological examination. This analysis involves examining a sample of tumor under microscope to look for abdominal cells. The presence of these cells can indicate cancer. Let's take a look at an overview of the imaging performed. Mammography. This is a gold standard for breast cancer detection. It can detect changes in the breast before they can be felt or seen. Ultrasound is used as a complementary test to mammography. It can also help guide a biopsy needle into the suspicious area to obtain a tissue sample for diagnosis. Mammography uses low-dose X-ray to detect changes in the breast, while ultrasound uses sound wave to create images of the breast tissue. In Mrs. Clanson's case, a thick needle biopsy was performed. This involved using a large needle sample. The sample is then examined by pathologists to check the presence of the cancer. A biopsy, while sample tissue is removed for examination, is the only definitive way to diagnose breast cancer. Let's take a look at the finding. In Mrs. Clanson's case, the histological examination of the biopsy sample confirmed the diagnosis of invasive ductal carcinoma, a common type of breast cancer. This information, along with the result from the imaging test and the patient's symptoms, help in determining the appropriate treatment plan for Mrs. Clanson, which include breast-preserving surgery and adjuvant radiotherapy. Remember, imaging tests such as mammography and ultrasound can identify potential abnormalities or changes in the breast tissue, but they cannot definitely diagnose breast cancer. Thank you.